Royal Mail Group has worked with national charity Mental Health Foundation to produce a series of short films on mental health and well-being for staff. This film is about the ways you can support someone when they are going through a difficult time.
It's particularly difficult to talk about mental ill health in a work environment. People are obviously fearful about how they'll be seen by their employer and by their colleagues as well. We know that there's a lot of stigma attached to mental health issues. I think people are very aware. They pick it up from conversations people have, their attitudes. It's very important to give a compassionate response when somebody opens up to you for the first time. You will have lots of times when you have conversations with people that you line manage. Those might be informal conversations where you're just making a coffee with somebody, or it might be through a formal conversation, for example, through supervision. It's just a real opportunity in supervision to talk about how people are doing, if they're having any kind of issues. If somebody is off sick, and if they're off sick with a mental health issue, treat them in the same ways as if they had a physical health problem. Send somebody a card, I'd text them to check in if they're okay. I'd give them that message that they're missed, and we look forward to having them back soon. I would always think about asking somebody if they have a problem. If there's indications that you're seeing yourself or other people in the team, maybe you're mentioning that somebody just doesn't seem to be very well, or they know that there's sort of something that's stressful happening in their lives. It's a compassionate thing to do, just to check in with somebody.
It's really a huge relief when you get to speak to someone that you trust and tell them about your concern and your feelings. And also giving me the opportunities to work from home or reduced hours. And just having someone there to listen to you, even if they don't know what to say necessarily, but they're just there to support you.
It might be that you want to suggest meeting up socially with somebody, go for a walk, go and have a coffee somewhere. Just make it a comfortable environment for somebody to open up and talk to you. What's helpful is for you to be prepared, not necessarily to anticipate that this is going to be a very difficult, concerning conversation, but to be ready if it goes down a track where you actually are concerned for somebody's mental health. You might be needing to talk to them about what kind of support do they have at the moment. Is there somebody they can talk to? Had they thought about talking maybe to their GP? And part of the preparation, I think, is having that information ready to hand, so that if you're in a situation where somebody obviously does need some support and support quickly, you can immediately provide them with the information. It's really important to listen to somebody, particularly if this is the first time that they've spoken to you about their issues. There's lots of ways that you can communicate that you are listening to them in a really genuine and compassionate way. Keep eye contact with the person, to communicate through your body language that you're engaged, and to give them a bit of space. Often if we're listening to something that makes us feel uncomfortable, we can maybe cut across somebody or interrupt them or appear distracted, and it's really important that you're able to hold all of those responses when somebody discloses something to you. It's really important, no matter what you're hearing somebody talk about, that you don't become judgmental. You can communicate judgment through what you're saying, but also through your body language. One of the things that I find really helpful when somebody's telling me something that I'm finding difficult to hear is I just try and stay very conscious of myself. I keep my feet firmly placed on the ground. I try to concentrate on my breathing and stay calm with somebody. Reassurance can really give people hope that this is something that they can come through. It gives them hope that they'll be supported in their workplace as well, that they'll be able to keep their job and keep the relationships that they have at work, as well as to give them hope about recovering their mental health. You don't need to be a mental health professional to make a difference.